Who's a 48-year-old gentleman who's had problem with his neck for some time, with severe neck and left arm pain. And if you look at his scan here, his MR here shows a large disc at 5/6. In the past, he's had it treated conservatively, but he had significant symptoms about 6 months ago with severe neck, arm pain, numbness, pins and needles, and difficulty really living, and life was hell because of pain in his neck going to his arm. We discussed various options, and obviously we try to treat everything conservatively, but sometimes when the pain is so severe and there's neurology, one has to resort to surgery. So about 3 months ago, he had an operation, and this is an intraoperative x-ray. You can see his x-ray there, and then we make a little hole, we find the correct level, you can see this little pin, and then we put a scaffold in, which gives us control of the C5 and 6 vertebra, which then allows us to take this vertebra out, put a little spacer in, and in this situation what we've done is put a disc replacement. And this is his x-ray at 3 months. You can see how we've put a cervical disc replacement in there, which maintains height, takes the pressure off the nerve, but more importantly, when he moves forward, you can see how that disc moves backwards and forwards. So it's basically recreating the normal physiology of the neck moving, so it spares the level above and below. But here's Matthew. So Matthew, what was your pain like before the op?
Before op, it was horrendous. Arguably the worst pain I've ever experienced, and I now find myself completely pain-free, without any medication to support that. So yeah, incredible outcome.
What was the most difficult part of the operation or the consent?
The most difficult part was probably just getting my head around some of the risks,
yeah.
but actually in terms of how it's ended, incredible,
yeah.
and very little trouble throughout the recovery.
Yeah. So I think we sometimes forget how severe pain can be, and spinal pain from a cervical disc or a lumbar disc can be intense, where living is very difficult. Even strong painkillers won't control the pain, together with numbness and
yeah.
losing the use of your hand is frustrating. In the good old days, you wouldn't have a consent, we would just get on and do the op, but these days we try to involve the patient in the decision making. So the consent I send people is quite comprehensive. Sometimes it scares them, but it's important you know about all the risks, because surgery is associated with risk. But I think you do it well, then the results can be really good, and you can get back to your normal activities. Thank you. And you're happy about me using this on my website?
Of course.
Thank you.
Sure.